Our initial consultation time is always 1 hour. I think that's unique. I have never seen a doctor for any reasons. I've had a few surgeries myself, so I know that surgeries can be very scary. Fortunately, I've had very, very good doctors, but I personally have never had an experience that we're providing, having the hour consultation, speaking to a doctor in their office first for a consultation, and then getting an exam, and then going back to their office for an exit interview. I've never had that experience.
That's like an hour face-to-face with both of us. So you're not waiting in the waiting room for 30 minutes.
Right.
You know, we spend hours at the doctor's, but you really only see the doctor for 10 to 20 minutes, where we have an hour just to be with you. We've had patients fly in from other states to have surgeries.
I've had patients internationally that would come in, and usually their story is usually very similar. Their doctors either told them that they had to have a big incision to do the surgery, or that they needed a hysterectomy. My message to women at large is that if you have fibroids, most likely we can remove it in a minimally invasive manner with a small incision through the belly button with a camera. My other big message is that, if your doctors have told you that you need a hysterectomy, chances are most likely you do not. Get a second opinion if your doctor told you that. We offer all available surgical options for our patients. Myoma is another name for a fibroid, and ectomy means to remove. So we offer minimally invasive myomectomy. And there's a new procedure, relatively new procedure, called Acessa, which is a laparoscopic, again, minimally invasive procedure, where we map out the fibroids with an ultrasound, and we stick a little needle inside and we melt the fibroid. This has been FDA approved since 2012. I've been doing it since then. I've been part of 3 clinical trials looking at this, comparing it to a myomectomy. This is when I was a associate professor at UCLA. And the studies show amazing results. The studies show that symptom relief is comparable to a myomectomy, and it's less invasive than a myomectomy. Basically, we offer our patients all of the surgical options that are available. And I would say less than 1% of all gynecologic surgeons in the nation are trained to do this procedure called Acessa. Another thing that I want to tell you about the Acessa, I've been doing it for over a decade now and have published 3 clinical trials looking at this. The Acessa was made by a smaller startup company, and when they were acquired by Hologic, which is a larger surgical device company, they sought me out and asked me if I can function as the proctor, their surgical consultant. I travel around the nation and I train other doctors how to use this new technology called Acessa.